Now is the moment we've all been waiting for, and the reason why we're here today, to hear from BCRF's panel of experts. It's my pleasure to introduce Dr. Cliff Hudis, moderator of today's symposium entitled Transforming Breast Cancer, How Laboratory Science Becomes Standard of Care. Dr. Hudis chairs BCRF Scientific Advisory Committee and is also chief of the Breast Cancer Medicine Service at Memorial Sloan Kettering. It is Dr. Hudis, along with BCRF Science Director Dr. Larry Norton, who leads the group that determines where BCRF grants are awarded. Let's give it up for Dr. Hudis.
Well, thank you, Andrea, and thanks to all of you. It's really a pleasure and a particular highlight of our day this time that we spend talking about the real scientific work that we all do. Now, you realize before we begin that we've picked 4 great panelists. I'll introduce them in just a moment, but we could have had any of the investigators who are here with us today or the ones who weren't here today. Every one of the funded investigators and their colleagues really could fulfill this role. They're really all remarkably talented people, and we're thrilled and honored to be able to support their work and, as you'll see in a moment, to also collaborate with them. So what we're going to do, and this is a chance for all of you to be engaged, and I hope you will, is talk for a few minutes about some of the specific work that we do. And each one of the investigators who are on the stage right now will spend a few minutes talking in understandable terms, they promise, about the work that they do. And when we're done going through that, there'll be an opportunity for all of you to ask questions of the panel. There are microphones that are being held by Ashley and Claire in the audience, and they will bring them to you. And you can ask us any questions at all. There are no dumb questions. There are just dumb people in front of you who can't answer them. So, and by the way, we'll call on some of the members of some of the grantees, rather, who are in the audience, because maybe some of the questions you have can better be answered by people who happen not to be here on the stage. So before we go further, I want to just take a moment and introduce our 4 panelists. First, to my left is Jose Basalga, and as you know, he's chief of the Division of Hematology Oncology and Associate Director of the Massachusetts General Hospital here in Boston. He's also a professor of medicine at Harvard Medical School. He's a longtime friend and colleague of many of ours, and as you'll hear in a moment, he'll be able to describe to you some of the ways in which we can take basic laboratory science and translate it into meaningful clinical advances that really change people's lives. To his left is Monica Bartonoli, who is almost a relative of mine, not quite. And she is a professor of surgery at Harvard Medical School and an associate surgeon at Dana-Farber and the Brigham and Women's Hospital. She's right now the chief of the Division of Surgical Oncology at BWH and DFCI. But I know her best, and you'll hear about this, because she's the chair of the newly formed Alliance for Clinical Trials in Oncology, the former CALGB, North Central Group, and ACOSOG. And if you don't know what those are, that's okay, but you'll hear about it, I'm sure, a little bit later. To her left is Lou Cantley. He's director of the Cancer Center at Beth Israel Deaconess Medical Center and chief of the Division of Signal Transduction. He holds a William Bosworth Castle Chair in Medicine at Harvard and is a founding member of the Systems Biology Department. He's really well known to all of us as one of the leaders in the development of a critical pathway, or our understanding of a critical pathway in all of cancer medicine called the PI3 kinase pathway, and you'll hear much more, I think, about that. And finally, Ursula Matalonis is the medical director and program leader of the medical gynecologic oncology program at Dana-Farber. She's associate professor of medicine at Harvard, and she is focused primarily her research on genetic changes in ovary cancer And this is not in the abstract, and again, keeping with the theme, what you'll hear about is how that understanding can lead to the development of practical drugs for individual patients. So that's the panel, and we're lucky to have them with us today.